2 weeks after the presidential lockdown of Lagos, Ogun, and the FCT as a result of the coronavirus pandemic, the rate of compliance has been remarkable as more suspected cases were added to the list of those undergoing treatment. This informed the extension of the lockdown to enable those saddled with the responsibility of helping to contain the virus to have enough time and more suspected patients to present themselves for Medicare. How do Nigerians see this extension? To what extent can we say Nigerians have contributed to the progress made so far? These and more on Panorama from the Lagos Network Center. I am Hinginu John Adams. We will be right back. Thanks for staying with us. 20 new cases of COVID-19 have been reported in Nigeria. 13 of the cases are in Lagos, 2 in Edo, 2 in Kano, 2 in Ogun, and 1 in Ondo. As at 9:50 p.m. on 13th of April, there are 343 confirmed cases with 91 discharged and 10 deaths. With the new cases, Lagos now has 189, FCT 56, Osun 20, Edo 14, Oyo 11, Ogun 9, Bauchi and Kaduna 2 each, Akwa Ibom and Katsina 5 each, Kwara 4, Ondo, Delta and Kano 3 each, Enugu, Ekiti and Rivers 2 each, Benue, Niger and Anambra 1 each. Now, President Muhammadu Buhari has announced additional 14 days extension of the current restriction order in Lagos, Ogun, and the Federal Capital Territory as part of measures to fully tackle the spread of the coronavirus pandemic. President Buhari, in a nationwide broadcast, said the adjustment became necessary following professional advice and briefing from the Presidential Task Force on the global pandemic. Abubakar Akwanga reports.
President Muhammadu Buhari explains that the difficult decision was informed by the growing concern of global statistics on COVID-19 and the increasing figure in the country, which desperately requires tougher preventive measures and sacrifice from all Nigerians.
Our approach to the virus remains in 2 steps. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners. With this in mind, and having carefully considered the briefings and report from the Presidential Task Force and the various options offered, it has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days, effective from 11:59 p.m. on Monday, 13th of April 2020.
The president says available data of the virus from the Nigerian Center for Disease Control in Lagos, Ogun, and the FCT represents 71% of recorded cases out of the 23 affected states. The Nigerian leader commends the 36 state governors for initiating proactive measures through various restrictions order imposed to contain the spread of the deadly virus and promised to strengthen commitment in high-risk states.
Many state governments have also made provisions for isolation wards and treatment centers. We will also build similar centers near our airports and land borders. Healthcare workers across all the treatment centers have been provided with the personal protective equipment that they need to safely carry out the care they provide.
The president says adequate measures have been put in place to sustain the fight against COVID-19. On the impact of the initial 2 weeks lockdown, the president says it has led to 92% of identified cases and commended the timely intervention of donors and other development partners in assisting federal government to mitigate negative impact of the virus and promised to sustain palliative measure to cushion the effect. Other measures include 7,000 trained health workers and their swift deployment to 19 states, doubles the number of testing laboratories in the country, and raised testing capacities to 1,500 tests per day, with Lagos and Abuja now equipped to admit 1,000 patients across treatment centers.
Palliative measures such as food distribution, cash transfers, and loans repayment waivers to ease the pains of our restrictive policies during this difficult time. These palliatives will be sustained. I have also directed that the current social register be expanded from 2.6 million households to 3.6 million households in the next 2 weeks. This means we will support an additional 1 million homes with our social investment programs. A technical committee is working on this and will submit a report to me by the end of this week. The security agency.
The president says the major space for the spread of COVID-19 is in communities and urged them to closely observe the infection prevention protection measures to curtail the spread of the virus, and appreciates effort of the traditional rulers, Christian Association of Nigeria, and the Supreme Council for Islamic Affairs and the media for sustained effort in succeeding the fight against COVID-19.
I am directing the Ministers of Industry, Trade and Investment, Communication and Digital Economy, Science and Technology, Transportation, Aviation, Interior, Health, Works and Housing, Labor and Employment, and Education to jointly develop a comprehensive policy for a Nigerian economy functioning with COVID-19. The ministers will be supported by the Presidential Economic Advisory Council and the Economic Sustainability Committee in executing this mandate. I am also directing the Minister of Agriculture and Rural Development, the National Security Advisor, the Vice Chairman, National Food Security Council, and the Chairman, Presidential Fertilizer Initiative, to work with the Presidential Task Force on COVID-19 to ensure the impact of this pandemic on our 2020 farming season is minimized.
The president says he has no doubt that by working together and carefully following the rules, Nigeria will get over the global pandemic and emerge stronger in the end. In Abuja, Abubakar Usman Akwanga, NTA News.
Curb the spread of coronavirus pandemic, President Muhammadu Buhari announced an extension of the lockdown in Lagos, Ogun, and Abuja, the Federal Capital Territory, by 2 weeks. As expected, this step has generated reactions from Lagosians. Annie Daniels, who went around town to sample the opinions of Lagosians, has details.
The roads and streets remain calm, devoid of the hustle and bustle Lagos is known for. Then we saw this crowd at these newspaper stands. They are known as Free Readers Association of Nigeria, and their topic of discourse is the extra 2 weeks lockdown declared by President Muhammadu Buhari in his nationwide speech on Monday, 13th of April 2020.
Lagos and Abuja today have the capacity to admit someone.
President Muhammadu Buhari announced that the extension became necessary after carefully considering the briefings and reports from the Presidential Task Force and the various options offered. This has generated divergent views from Lagosians.
In Europe, in China, Europe, Italy, US, see thousands of people are dying. It's real there.
I've been expecting that the lockdown is extended. We have to survive the sacrifice because if the lockdown is not extended, the virus might spread.
While respondents see reasons with the government to extending the lockdown, their next wish is that palliatives and food stimulus made available gets to the right quarters. In Lagos, Annie Daniels, NTA News.
Joining us to discuss more on the extension of the lockdown is a consultant clinical microbiologist at the Lagos University Teaching Hospital, Dr. Rita Oladele. Doctor, you're welcome to Panorama.
Thank you. It's lovely to be on set again.
Let's start on this note. What is your comment on the presidential broadcast?
Well, I can imagine the pain of the presidency having to still keep a part of the country locked down. It's affecting the economy, but it's for our good. The president has been advised by professionals in the field who have looked at it. We're doing a great job so far, but there's still need for more of this lockdown so that we'll be able to break the chain of transmission of this infection. So everybody just have to put hands together too. It's painful, but we need to do it. It's our country. We'll preserve our lives. And everyone needs to stay safe. While NCDC does the job of tracking the cases, isolate, quarantine people, and ensuring that this infection does not spread.
Just talked about people ensuring that they should stay safe. People have fear for their well-being as the lockdown has been tough on them. Now that another 2 weeks have been declared, what should the people be doing immediately?
Well, immediately, I think we still need more community awareness on the program. People need to understand that the government is doing it for the collective good of all. So people need to educate themselves. It's not a death sentence. It's something that we'll get over. And it's a good time for people also to discover, rebond within the family and discover new ways of doing things while staying at home. I mean, great ideas to capitalize on. But for now, we need to break the chain of transmission. We must stay at home.
Okay, talking about breaking the chain of transmission, some people don't still believe that COVID-19 is real. Because I can remember yesterday I was talking with somebody, she was saying, is it not typhoid or malaria? What should the government do to complement the successes already achieved? Because if we have people like that, the successes already achieved will be tampered with.
Yes, I agree with you. And if you noticed, right from the beginning, I said we need to also make more community awareness. So we need to drive awareness. I mean, the government have involved churches. If you listen to the president, he commended the churches, the traditional rulers. He commended quite a number of people in the industry. But we also need to do community awareness. People need to understand the basics of the infection and how to break the chain of transmission. Because COVID-19 is real. We have cases. We have had some good outcomes and we have had a few bad outcomes. So the information needs to go there to the community level in language that they can understand and communicate to others so that we can all contribute our part in this fight against this pandemic and make sure that as a country we win.
All right, in the broadcast, the president directed that the current social register be extended from 2.6 million households to 3.6 million in the next 2 weeks. What is your opinion on this as it affects Nigerians that have not benefited from the palliatives?
I mean, I think it's a very good initiative on the part of the presidency. I sincerely hope that it will be delivered so that way the palliative measures can reach more. Because yes, a number of people a number of families are suffering out there. But then what is being done is for our collective good. So people should be rest assured that we believe that the presidency, the government will deliver on this promise and that those palliative measures will help to ensure that people stay home.
Now, there are a lot of reactions by some Nigerians in some parts of Lagos and Ogun State. What justification do you think they have to engage in it?
What kind of reactions are you talking about, sorry?
Concerning the extension, there are a lot of people are complaining. Some people are complaining that they don't have food, this and that. What do you think?
Yes, I do agree. A number of people. I mean, we have, especially in places like Lagos, a lot of people live from hand to mouth. So a lot of this livelihood, the people that hawk water, the people that hawk things in traffic, a lot of people live hand to mouth. So it has affected a lot of lives. I totally agree. But at the same time, we have to have this balancing act. At the same time, COVID-19 is real. We have had cases diagnosed, we have had cases successfully managed, and we have had some die. And then don't forget that we live in a very populous city. I mean, look at Lagos State. Sometimes you try to imagine the amount of people in Lagos and you think people are being stacked on top of each other. So if we do not control the outbreak in Lagos, a lot of people will die. Our healthcare system will be overwhelmed. And that is what the government is working towards, to ensure that we don't overwhelm the healthcare system. Because if it does, we'll end up in a situation like what is happening in Ecuador, where people, cops are lying on the street. People are dying and nobody to cater for them. So the government is trying to prevent that, to prevent our healthcare system from being overwhelmed. People should put hands together with the government and ensure that we win this. It's painful, yes. The palliative measures might be a little bit slow coming in, but they will come in. It's for our collective good. Together we need to fight this war. As painful as it is, we need to win the war against COVID-19.
Okay, we've seen a lot of people observing the washing of the hands, social distancing, and other preventive measures. What do you further advise that people should do to avoid this pandemic?
Well, if you notice, there's a new, it's not guidance, it's not a recommendation, but there's now a new advocacy for face masks being used by people if they have to be outside, because there have been some issues with the fact that the transmission could also be airborne. There are not extensive studies to confirm this. So people can also use face masks if they have to go out to get some essential things. The use of face masks will come in beneficial. And then the hand washing can not be overemphasized. And as much as people should consciously avoid touching their faces. And if you touch surfaces, wash your hands. And then there's a proper way for hand washing. It's not just getting water and rubbing your hands together. No, there's a proper way for hand washing. And we have a number of videos out there to show you how to properly wash your hands. And it's with soap and water. And if soap and water is not available, the alcohol hand rub, or what we call the hand sanitizer, is very useful. But also there's a proper method of doing it.
All right, thank you.
So the face mask cannot be overemphasized now. The cloth face mask, we don't want the medical or the surgical face mask, because we need that for use in your hospitals. So if you don't have a face mask, the cloth face mask, you can use a piece of scarf or a t-shirt. Just make sure that it's double layer and tie across your face if you have to be outside.
All right, thank you very much, Dr. Rita Oladele, for coming on the program.
Thank you so much for having me. It's a great pleasure to be able to serve. Thank you.
This is NTA Panorama. Thanks for being there. You're still watching Panorama, coming to you live from the Lagos Network Center. Let's still talk about coronavirus. There are now 11 laboratories nationwide to test for COVID-19, with testing capacity increased to 1,500 tests per day and over 6,000 tests conducted so far. Chairman of the task force and secretary to the government of the Federation, Boss Mustafa, who stated this at the daily briefing in Abuja, said war against the pandemic is a must-win for the country. Mitaire Ikben tells us more.
Taking Taking stock of Nigeria's fight against COVID-19, members of the Presidential Task Force were confident that the initial 2-week restriction order in Abuja, Lagos and Ogun states has slowed down the spread of coronavirus in the country, even though it is not yet Uhuru.
The war is still raging, and all hands shall remain on deck until victory is assured.
Those that have immunosuppression, such as cancers, and those with chronic respiratory disease, it is important that this group keep away from persons who may have coronavirus.
To guard against community transmission of COVID-19, the Minister of Health emphasized increased use of the face masks by Nigerians.
It includes also the improvised homemade face mask, or anything that covers your face, even a handkerchief or a scarf. If you're talking to someone and at least majority of it will be arrested on a mask. That's why we say that it must be washed every evening, preferably in warm water, and then dried and then ironed. If you do that, you are safe to reuse it the next day.
To facilitate the distribution of palliatives to cushion the effect of restrictions on Nigerians, the task force says the National Social Register is being expanded with focus on the urban poor and persons living with disabilities.
We have 4 pilot states that are on digital payment. We're using mobile phones, mobile wallets, the BVNs of these beneficiaries where it exists, because you know that it's not all of these beneficiaries that are on the banking system. So we look at all these issues and we're working on it.
The Presidential Task Force assured Nigerians that government will not fail to fulfill its responsibility of ensuring their safety and security at all times. In Abuja, Mitaire Ikwen, NTA News.
Following reports of evolving dimensions to crime in Lagos due to the lockdown, the Lagos State Police Command says it has arrested over 100 suspects for various offences. Police spokesman in the state, Bala Elkana, while giving an update of the security situation, also disclosed that special police operations units have been deployed to strategic areas to contain the situation. Dotun Ogwemi has the report.
Hitherto busy public offices, including the Lagos State Police Command Headquarters, Ikeja, are devoid of usual activities. But while its offices and cells are almost empty, police officers are not working from home. They are on the streets, ensuring that residents comply with the total lockdown. All seem to be going well. However, in the last 3 days, people have suffered increased apprehension with reported cases of crimes. Some footages have been circulated on social media showing citizens rising up in defense of their communities. In the course of this report, I came across Nathan Hawk at Ojoelegba, who shared his experience.
Even in other bridge Ojoelegba, some boys, you don't know what they were planning at night. Maybe some of them will use machete, they will just go somewhere, just before you know you've come in the morning. Even in my place, what they call Shifawu. Like 2 shops, they broke 2 shops.
For the police in Lagos, swift response and improved community relations will instill sanity in areas, especially around inner roads and streets.
If the lockdown now continue, those guys who live on crime are hungry, they are tired at home, they will make an attempt to come out. Then our special teams will face them, which is exactly what we have done last night, and we're able to bring the situation under control, and we will sustain it all through the lockdown.
Can you tell us some of those areas where you actually deployed some of these special?
We have Abulegba area, we have Ayobo area, we have mostly under Aliwosho area, we have also Ogba area, and some few other areas like that. But the deployment is all over.
The police enjoins members of the public to remain calm and call its control center in event of any emergency for swift response. In Lagos, Dotun Okunyemi, NTA News.
In the meantime, President Muhammadu Buhari has signed the Regulation 220 of 2020. In a statement from the Office of the President, the signing is in response to the COVID-19 pandemic, which the President issued on the 30th of March 2020, by which he declared COVID-19 a dangerous disease. As part of efforts to defeat the disease, the President ordered the restriction of movement in Lagos State, Federal Capital Territory, Abuja, and Ogun State for an initial period of 14 days with effect from Tuesday, 14th April 2020. Up next is Sports Update.